Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome Dr. Camille Kawind. Now, you are an infectious disease specialist with a practice here in Salisbury to the program to discuss a very relevant topic, and that is Ebola. So welcome to the program, and please inform us about this. There's a lot of hype in the media about what's going on with Ebola, with news updates every day. So we're here to provide information about this epidemic. Of course, it's an epidemic in Africa, not here. But tell us, just what is Ebola?
Thank you, Mary, for having me on your program. Ebola virus is part of a family of viruses that are called filoviruses. Viruses mean philo, the word philo, filament. It is thread-like. The word philo means thread. It looks like a thread and it's coiled at the end. It's a virus that has the characteristic of being rapidly replicating, meaning it produces itself in a very rapid way. And one of the reasons that it overwhelms the immune system very quickly, and patients get very quickly very sick, as compared with the HIV virus that is a slow progressive virus. This one is, because it is rapidly replicating, it forms copies very quickly. People get very sick in a very quick manner.
And it's been around a while, hasn't it?
It's been actually discovered in 1976. It was discovered on the east part of Africa, where the outbreak now and the epidemic is on the west part of Africa. It was discovered in South Sudan in a cotton factory. There were doctors from Europe and from the CDC investigating a small outbreak there, and they found out a virus that has the manifestation of infection similar to what we have now, which is the Ebola virus. And then in 1976, that virus from South Sudan went into Congo. In Congo, it was close to a river called Ebola River. That's where they found the outbreak again in Central Africa, in Congo, by the Ebola River. And that's where, when they discovered the virus and found out what it does, they called it Ebola virus.
And it used to be called hemorrhagic fever, correct?
It used to be called, and it's still called hemorrhagic fever, because it causes a lot of manifestations that have to do with bleeding and coagulation problem with the body. And people would present at the end stages of the disease, or probably in the middle of the symptoms, with the bleeding from the nose, the mouth, the ear, almost every orifice, the eyes, the rectum. From the urine, there is bleeding everywhere. Even the blisters, when they develop on the skin, they bleed. Even when you take blood from those patients at the punctured site, they bleed. And they bleed actually almost, unfortunately, to death. Meaning they become in shock, and then they lose all the support of their own natural organs, heart, liver, kidney function, and blood pressure. So they need a lot of supportive care during that stage.
So that's, you were talking about in the 70s, that's how it kind of came about, and it was very dangerous. We didn't know much about it.
Right, and the rate of death at the time, it used to be about 90 to 100%. So 90% to 100% of those people used to die when they get the infection because of lack of supportive care. Not because of treatment, because we still don't have a treatment for it.
Well, let's talk about what's going on today, or in the last, few weeks, months, when this has kind of come into the news big time. And it's mostly right now, we're talking about 3 or 4 countries in Africa, correct?
Right. We're talking about the 3 main countries in West Africa that are Sierra Leone, Guinea, and Liberia. And that's actually, it started the outbreak started in Guinea. And there are so many stories about how the outbreak started at the time, which is a year ago. It started last March. And people have customs in those areas that are different than ours here, and they are exposed to the virus in a usual daily way that we are not here. And they have habits also and beliefs and other things that contributed, and in addition to poverty. And also they just came out from wars where there is no healthcare infrastructure, and they still live in houses made of straws and in the rainforest, and they don't have enough sources for food, so they depend on hunting, and then when they hunt those kind of animals. And
What kind of animals are we speaking of?
well, unfortunately, it's monkeys, chimpanzees, gorillas, bats, and other animals that they find in the rainforest. All those, they could be either contaminated or infected or carrier of the virus, and then they butcher them. And when they are cutting them, they use bare hands, and they don't use any precautions, so they expose themselves. And then when they touch any mucous membrane or even on the skin, they get infected with the Ebola virus, as transmitted from those animals. They use the bush meat, and bush meat is a main source to transmit this virus.
So they're actually eating that meat that's contaminated too.
Right. What they do is, when they form the bush meat, it's like a smoked meat, and then after it's burned and it's grilled, they keep it dry, and then later on they put it in water until the flesh is moist enough to be eaten. And that's one way of transmitting the disease. Another interesting way of the disease transmission is through fruit bats. When the fruit bats, it's been found that they carry this virus. It's called ribonucleic acid virus, RNA virus. It's a single strand virus that is carried by the bats, and the bats also carry the rabies virus, which is similar to the Ebola virus. So the fruit bat comes to the fruit, eats on the fruit, contaminate that fruit with the virus, drops it on. Probably they not necessarily eat the whole fruit. They drop it on the ground, and then animals come by and they eat this fruit that is contaminated. They get the infection. Humans come and hunt those animals, and they eat them. They get infected. And the human, not only from animal to human, but also from human to human, the infection is transmitted through body and body secretions too.
Yes, we'll get to the transmission, but I think it's interesting to note that their practices over there are so much different than what we do here, which constitutes why we call. What constitutes an outbreak versus an epidemic?
Well, it's now involving the whole country. So the whole country is at risk for anybody who lives in that country to be infected. So there are many reasons to progress into that stage. Now it across the borders to other countries surrounding. They are neighboring countries by the border. The other two countries between Guinea, Liberia, and Sierra Leone.
Is it also in Nigeria?
It is. It's crossed into Nigeria.
I saw a map that also had Nigeria
right, and
highlighted.
People travel and they don't know they are exposed, or they have the infection, or try to hide, and they travel through borders, and you need one case to start an outbreak, unfortunately. The burial, there are many other methods of transmitting the disease. When they bury, and do you want me to talk about this? Or
it's okay.
Maybe later. The burial and the funeral and how they prepare the body. They have a strong belief that anybody who goes to the hospital is not coming back. So unfortunately, they try to hide their sick family members from going to the hospital. When they hide a sick person in the house, this sick person is exposing the family members. The family members is exposing friends and neighborhood. The neighborhood is exposing other people who they are in contact with. So when this sick person in the family dies or is dying with the infection, it's already infecting everybody. Not to talk about the environment where they live, with it, which is small, but it's all contaminated and infected. When the patient dies, their burial habits are to touch the body, to clean the body with bare hands, and to kiss and hug and be in close contact. And then they touch themselves, and that's one of the main reasons why previous outbreaks have been controlled, because there are a lot of volunteers that go through the CDC, through Doctors Without Borders, through the NIH, through the World Health Organization and other institutions from Europe and other countries, to teach people how to deal with infection control measures, because until now, infection control measures are the most important to control this disease, in addition to the supportive care. So in the other outbreaks since 1976, when they happened in other countries, they were able to control them because they were able to educate the people there on how to practice and how to avoid touching infected dead people, because even after patients die, they are still infectious.
If you're dealing with the blood and body fluids and
Right.
such. Okay. So just to clarify, it's spread human to human or mammals, which you're saying over there, that's very common with the bush meat and such, not by insects, correct?
Right, right. So far, thank God there is no transmission through mosquito, because if that happens, like for example other diseases, it could be disastrous globally.
Right.
And also, the first episodes of transmission were what contributed to that is malaria and yellow fever are very common in that section of Africa. So when everybody comes to any clinic, if there is a clinic, and unfortunately, the rate of healthcare in those countries is one physician to 70,000 population. So you're talking about one physician to every 70,000.
70,000.
Right, that's a really small rate. So
Yes.
when they come to any place, any clinic, with fevers, it's thought to be malaria until proved otherwise. So what they do is they inject them with anti-malarial drugs. One of the outbreak that has been reported is they were using the same needle and the same syringe to be cleaned in the same sample, in the same pan, and one of the patients had Ebola, and it infected the other people who were coming, including the staff in that facility. Because they were exposed also without gloves to the infected, contaminated syringes.
Well, not to alarm people, of course, but that's practices over there which aren't really happening here. I mean,
Right.
we are much stricter and ahead of the game there, and we'll get to that. But I also wanted to talk about the incubation period too, from getting first infected until you show symptoms.
Usually it ranges between 2 and 21 days. Most of the cases have been reported within 2 to 14 days, 2 to 10 days. Initially, it starts by after being exposed. When the patient is in the incubation period, usually they are not infectious. When symptoms by maybe day 3 or 4 start showing, they become infectious. The first symptoms are high fevers and severe headaches. That's how it starts, and then muscle pain, back pain, and then it progresses into diarrhea, abdominal pain, and nausea and vomiting. Then it progresses more into a rash that could be in the face, on the hands, on the trunk, on the chest, and the rash could be small blister to big blisters, and then it could progress further into affecting the liver, the kidney, and it becomes the coagulation system become
By coagulation, you mean clotting. The blood does not clot normally.
Right, does not clog, and it leads to bleeding. So patients start having bleeding from the nose, from the mouth, from almost every orifice in their body: eyes, ears, rectum, the urine. And not only bleeding externally, they bleed internally too. All the organs bleed inside.
What about bruising? You'll see bruising as
And
well?
in addition to bruising, and unfortunately, this virus affects the specific cells in the body responsible for the immune system. So patients lose their immunity early in the infectious stage. They don't have enough immunity, and then they progress into those hemorrhages where they lose control over their body organs.
So how exactly then, I mean, in this country, is it transmitted? Since, I mean, I just don't want to alarm people. We don't eat monkey meat and bats for the most part, I would say. But in the U.S., let's talk about how is it transmitted?
In the U.S. now, the only transmission, we don't have a transmission from patient to healthcare worker in the United States. There has not been a reported case like that. The cases have been reported in Africa, and the patients came here.
And transmitted it
right.
by blood, body fluids. I'm
But-
saying you can't get it by coughing in the air or...
No, the mode of transmission commonly are through either exposure to blood or body secretions. Body secretions could be saliva, could be the urine, could be the sweat, could be the vomitus that the patient throw up, and could be the stool because they have diarrhea. And if we do have to take care of patient here in the US, those are the main routes where if we don't use infection control measures by putting gowns, putting gloves, eye protection, face protection, gowns also, and not expose ourselves to the patient secretions, then most likely we're not going to get the disease. And that's the difference between here and what is happening in West Africa.
And that's also assuming that we are becoming adept at identifying cases or suspected cases from people that travel from that part of the world, correct?
Right. That's correct.
There's screening going on at airports and things.
Right. The CDC is really getting involved big time and from the beginning with many organizations, as I mentioned earlier, including the World Health Organization, the Physicians Without Borders, the NIH, as well as the government, the U.S. Defense is involved by sending the troops and by also notifying and educating all the airports, all the institutions, including all the hospitals. Every hospital almost in the United States has received recommendations, policies, and guidelines related to how to deal with a patient infected or exposed to Ebola. Almost any hospital in the United States is relatively, I believe, prepared based on those guidelines and policies to deal with a patient who has Ebola infection, as long as we have isolation rooms and the nurses as well as the physicians and the healthcare worker understand what the standard of care are for those kind of patients.
So just to reiterate, you can't get it from just walking down the street or a cough. It's not airborne. It's strictly touching blood and body fluids and then, say, touching your eyes or your nose or your mouth and getting direct contact.
Right, and it is not, and that's a good, in a way, it's good news that it's not by air, it's not airborne. So unfortunately, the fear is that if the virus mutates, so far there is no proof that this virus is mutating, but there might be mutation, and or transmitted by airborne. So those two things are not existing yet, which makes it a virus that outside of Africa it can be controlled. And the CDC's attitude is to control the infection, as stated by the director of the CDC, at the source. So all the efforts, as we see now on the news, are made to control the infection at the source where the infection started and the epidemic started, and keep it there under better control. That's why the troops are building facilities to have access for people who are infected for medical care and for supportive care, because that's all what they need at this point. if you give fluids and electrolyte and nutrition and control secondary infections to those patients, the rate of recovering is going to be higher than what we see now. The rate of death now is between 50 to 70%. So out of 10 people who get the infection, you have 5 to 7 people who will die, regardless, treatment or no treatment.
Now, how do we diagnose it? Is there a blood test that we can determine someone has Ebola?
Right. When we have a case where we suspect or there is high suspicion for Ebola, we contact the health department, we draw blood from the patient, and we send the specimen under approval. We had to notify the CDC. If the CDC approved that, we send it to the CDC. It's a blood test and it's done. It takes usually between 4 to 8 hours and we will have the results back.
So the results are back fairly quickly,
right,
so that you can make sure, well, you're isolating that person in the meantime.
Right.
They're under quarantine.
Right.
And the only way they can transmit it is once they start having symptoms. So
Right.
I guess that's a good thing, that
It
someone's
is.
not walking around not knowing and transmitting it.
Right. It is a very good thing because as compared to other viruses like the flu, you can transmit the infection while you are in the incubation period without knowing that you might be having the flu. In this case, once you have the symptoms is once you are infectious.
Now, just to reiterate again what the signs and symptoms are, you're saying a fever of what, at least 101.5 and greater generally, and
Right, 101.5 and higher is one of the guidelines to diagnose this. In addition to the other symptoms, which are the severe headache and the nausea, vomiting, and muscle pain, and the rash and the bleeding.
And it sounds like if you go undiagnosed, it's rather dangerous. Like, what effect is that virus having on the body? I mean, I think you mentioned it just causes this bleeding problem. It's usually something that leads to death, and it also causes your various organs to fail.
Right. What happens, unfortunately, is that this virus, if I want to simplify it, it affects first the immune cells, the cells that are responsible for the immune system. It's carried by those cells that try to fight the virus, but it infects them. And then it infects also the lining of the blood vessel. There is something called endothelial lining of the blood vessel. Either the small vessels, the capillaries, or the large blood vessels, it causes them to rupture. So you're starting with a virus that affected your immune cells in the beginning, and then it's affecting now the cell wall of the blood vessels, and also it affects the liver and the kidney and other organs to cause cell death. The characteristics about this virus is that when it infects a cell in our body, it uses this cell to become a factory to generate the virus. Unfortunately, it makes our body a factory for it to replicate and make copies of the virus, and that's a consumption disease. It consumes our body to make its own to survive.
And you're saying right now there's no magical treatment or medicine, it's just supportive care. Are we having better success here in the U.S. when we promptly diagnose someone and give them the supportive care they need? And does some of the success depend upon their own strong immune system?
All those, because here we have a better supportive care. We have hospitals and healthcare system that is one of the best healthcare systems in the world. So we support patients with IV fluids and nutrients and access to healthcare very, very quick. So we are in good control in this part. The other part is with the medication. There is no proved and tried medication yet on humans, and that's why there was a special permission to get those drugs that we heard about in the news, but there is no proof. They haven't been worked on a human to make a conclusion if they work or not, and if the long-term side effects or benefit of those drugs is guaranteed or what is looked at.
So there are some experimental treatments?
There are experimental drugs. Few pharmacies here and around the world are working on developing what we have now is what is called monoclonal antibodies, which you give antibodies to try to, if this is the virus, with the antibodies you want to try to block this virus to attach to the cell and kill our body cells. So those drugs work by preventing this virus to multiply or to attack our own cells to reproduce itself. And it's still in the early stages because it has to go from animal stage to human stage. It has been tried on gorillas, on chimpanzees, and there have been good outcome and results with it, but this is not yet to be approved until it gets to the human stage.
And what about a vaccine? Is that being worked on?
The NIH just has announced recently by his director that they are working on a vaccine in cooperation with the FDA to find a vaccine and a treatment. And until we hear from the NIH and the FDA if there is anything to be approved, there is nothing in the world to be approved yet as vaccine or treatment.
So are you confident that the CDC, they come across very confident that they can contain this and that it's not going to become, a serious health issue or epidemic?
Right. It's interesting you're saying that because one of the presidents in those West African countries where they have the outbreak has called the CDC the 911 of the world. And he just said it clearly. And I think we're proud to have the CDC because the CDC is doing unbelievable amount in providing care, and in addition with to other countries, but who have joined the CDC to support with supplies, support with whatever need they need over there, and with material also to build facilities. So not only the CDC is doing this medical part of the outbreak, dealing with is dealing with everything. Has sent guidelines and policies everywhere, from airports to hospital institutions to nursing homes to every other facility that could be in contact with any foreign person who comes from or a traveler who comes from that area.
I know I watched the recent press conference, and it sounds like they have a very good system in place too for identifying a case and then all the contacts and quarantining those until they, show that they're not infected with Ebola. But you're saying once someone has the symptoms, they are infectious, and they would need to be quarantined and receive treatment.
Right.
And for how long would a person be quarantined?
21 days. They should be isolated, quarantined for 21 days. And if they come from an area where there is the outbreak and there have been exposure, if they don't have any symptoms here, they are quarantined at home. They can still go to work if they don't have any symptoms, but for 21 days, if there are high suspicion for the infection, then they are quarantined not to go anywhere and they stay at home until 21 days. No symptoms, then they are free.
And then if someone does have the infection, then they're treated, and if they're successful, then they can get a blood test to determine that it's negative for Ebola, and then they're fine.
Right, and it's very important that when somebody is coming from that area, or if a traveler is coming to the United States, which is a tricky thing because you don't know who you're sitting close to in the airplane, or who was in the airplane that could have come from West Africa and, for example, stopped in Europe and took another plane to the United States, and another person from the United States is in that airplane. So, but that person was not in Africa, but he was exposed, and that's going to make it very difficult to identify the exposure with the travelers. That's why they screen them with the laser screener on the airports, and they are giving questionnaire about exposure and fevers. Although those laser screening tests probably sometimes are not very accurate, there is high false positive associated with them, but still you can tell by what the CDC is recommending and their guidelines that are issued to the airport to screen also by questionnaires the travelers who come from those areas. It is highly advised that if you don't have any necessity to visit those areas at this point in time, not to do it.
That sounds like good advice to me. So I guess we'll wrap up by mentioning that, you know, it's direct contact. It's not something you can get very incidentally. It doesn't live on surfaces, does it? It's strictly body fluids.
No, it does. It does live on
live
surfaces, and that's one method of the also transmission.
So disinfecting, of course.
Right, and it lives up to 2 hours on surfaces, and that's a healthcare exposure issue, because when we transmit when we draw the blood, really that has to follow certain guidelines, not to expose the laboratory people also. That could be, there have been cases associated with exposure from the lab. So within 2 hours, the virus dies on a dry area.
Well, it sounds like we have some systems in place that hopefully this won't become a severe health issue.
We do.
And you're confident of that.
I am very confident.
We want to allay fears. We don't, you know, I hate to create hysteria, but I think it is a true problem over in Africa for reasons you explained, because they have no healthcare infrastructure and lots of different cultural habits and rituals and things that make it much more easily to spread the disease.
Right, and because now we are more aware with the internet and with the spread of the information to and the communication to everybody, and the education about being aware of the disease. So I think as a small community, as well as a state, and then as the country, we all are aware, almost we I hope are aware of who has come from as a traveler and how we are exposed. And I hope all the travelers be honest about reporting their exposure status, because that could be fooling sometimes for the doctors. The reason I'm saying that is because we're heading into the flu season, and we don't want somebody who hide a travel history or exposure history to come in and only tell us that his symptoms are flu-like symptoms, or we can exclude that his symptoms are flu and they might be probably either Ebola or Ebola plus flu or only Ebola. So it's going to be a little bit confusing at some point, but that's why we need to be aware as health professionals on how to screen patients, and the patients have to be honest with us too.
Well, thank you so much, Dr. Kawan, for making me and hopefully all our viewers much more aware of, you know, the state of things with regards to Ebola. And we'll post some websites at the end of the program where people can get more information. Obviously, the CDC is a terrific website where viewers can get information about this.
Yes, and thank you, Mary, for having me on the program. If you go to the CDC site, you will see a lot of pictures of how patients look when they have Ebola symptoms, and I really advise our viewers to take a look at those, because it's very important to recognize how the patients look when they are sick like that.
Well, thank you again.
Thank you very much.
And thank you for joining us for this edition of Focus on Health here on PAC 14.
Focus on Health is sponsored by Peninsula Regional Medical Center, a proud supporter of PAC 14 programming.
Hi, I'm Peggy Nalepa, President and CEO of Peninsula Regional Medical Center. PRMC is privileged to partner with PAC 14 to provide educational healthcare programming for the Delmarva region. Peninsula Regional Medical Center, a proud supporter of PAC 14 and public access television.